Consider this. More than 100 people die every day from drug overdoses. About half those deaths are opiate-related. Opioids are a class of painkillers, and the Centers for Disease Control and Prevention says that opiate epidemic is one of the top 4 in the nation. Now a Denver-based company is fighting back, creating a unique app doctors can use to monitor their patients' painkiller use. New at 5, Denver 7 Sally Mamdooh joins us with more on how this software can make a difference. Sally, this is a big development.
Tony, this software is the first of its kind in the nation. It just makes it easier for doctors to access users' information on their patients without the hassle of all that paperwork, which often makes it easy for opiate addicts to go undetected. They're lethal, yet fall into the hands of most Americans.
It's estimated 259 million prescriptions were dispensed in the U.S. a year ago. And that's enough for every American adult to have a bottle of prescription opioids.
And CU professor of pharmaceutical research Robert Valek says unsupervised opiate use could lead to deaths. In Colorado alone, 40 people die every month from overdose. It's why CDC came out with guidelines recently urging doctors to prescribe opiates safely. But Valek says the guidelines alone were a problem.
It gets overwhelming for doctors.
It's why he co-founded the first of its kind software for doctors, which allows them to keep tabs on their patients using painkillers.
The doc can clearly see what's going on one screen and doesn't have to scroll through a bunch of stuff.
Patients provide daily updates through the software's app.
Every week we screen for the things that are important to ask about.
The data collected from the app, along with patients' lab reports and pharmacies they often visit, are then fed back into the system, helping doctors see how painkiller prescriptions are affecting patients.
They can go right on to problem solving.
It's a tool, Valek says, helps prevent misuse from turning into an overdose.
We wanted to put them all under one system, so when a doctor takes out their pen and decides, I want to prescribe an opioid, we help them do all of the things they need to do it safely.
Prior to using the software, doctors were able to follow those CDC guidelines about 10%. Now, after using the software, researchers found that doctors were able to follow the CDC guidelines by 97%.
Thanks, Sally. Here's an interesting perspective for you. According to the Colorado Department of Regulatory Agencies, enough opiate painkillers are dispensed in Colorado to supply every adult with one pill every hour of every day for an entire month.
Wow.